Welcome to Fit On. I'm Walters from Rehab Science, and today we'll be going through a lower back pain routine. So if you've got pain across your back or maybe just on one side, this will be a good program for you. Our first exercise here is going to be a gluteal muscle and deep hip rotator release or self-massage. So you're going to take a foam roller, set it down on the ground, and you're basically going to sit on that roller, and we're going to start on one side. We'll do both legs in this workout. So just pick one to start with. I'm going to start with my left side. You're going to sit down and turn to that left side, putting some weight on your arm. And then you're looking for tenderness, sensitivity, areas of sensitivity in that kind of buttock region, those gluteal muscles. Again, underneath those gluteal muscles are our deep hip rotators. They're like the rotator cuff of your shoulder. These are the rotator cuff of your hip. So you're going to roll through there, looking for tender points. If you find something, you can hold on it. Take a few deep breaths and just try to think about letting it kind of melt and relax. So we're working our hip muscles. The hip is the next adjacent joint to the spine, the low back. And a lot of people with low back pain, if we address the hip muscles, it actually can help reduce back pain. So just work through there, kind of slowly move to a new spot. If you find something that's tender, kind of pause on it, see if you can get it to release. If being in this position here is too easy, if you don't feel a lot of tenderness, you can cross the leg that you're massaging, which will put some stretch on those hip muscles. And again, just work your way through, kind of try to work through that whole buttock region, slowly moving your way up. And again, pausing. I've got another tender spot here, can pause and just try to get that to relax and desensitize. Okay, so there's a little bit more. Usually we'll spend around 30 seconds to a minute releasing and massaging a muscle. Okay, nice. All right, from here, now we're gonna take that foam roller out. We're gonna stretch those same muscles. So we're on our left side, we're gonna lay on our back. And for this one, I want you to straighten your right knee, straighten your right leg, and then for your left leg, you're gonna bring it up and pull your knee across to your opposite shoulder. So we're looking for a stretch here in those muscles we just mobilized. So pull that knee across and try to create a stretch that I'm pulling my knee to my opposite shoulder, looking for a stretch in those gluteal muscles, making sure not to rotate my spine. We're holding each stretch for around 30 seconds. If you find that this is too easy, maybe you don't feel a lot of stretch here, another way to do this is to cross the leg over the other one and pull up in this sort of figure 4 position. So once you have it there, just hold. We're just gonna hold it, let it stretch. Again, just try to take some deep breaths and let the area relax. If you hold long enough, a lot of times your body will just kind of release and the tension will decrease and you'll gain more mobility. So again, stretching those deep rotator muscles and the gluteal muscles. Okay, good. So for our next exercise, we're gonna go on to a hip flexor stretch, still staying on that left side. For this one, I'm gonna put my left knee on the ground and I'm gonna have my right leg up here to sort of a 90-degree angle, my hands on my hips. I want you to tighten your abs and your glute muscles first. We're gonna preset by doing that. So kind of squeeze your abs and your glutes. This will create posterior pelvic tilt. And then from there, I'm gonna lunge forward slightly without arching my low back. So just kind of sliding forward, looking for a stretch right here on the front of the left hip. So this is gonna stretch our iliopsoas group, muscles called iliacus and psoas, our primary hip flexors. Those muscles go from our leg and attach on all the levels of our low back. For a lot of people, stretching these muscles can help reduce back pain. Perfect, hold just a little bit longer. Some deep breaths. Really try to fill that stretch on the front of the hip. Perfect. All right, so our next one here is another mobility exercise. This time we're gonna address our sciatic nerve, which is the major nerve that comes out of your low back. You're gonna use a towel at home. So just find a long towel or a belt. You're gonna hook that around your left foot, and then you're gonna lie on your back again, right leg out straight. On this one, what I want you to do is bring your leg up with your knee straight slowly, just until you start to feel tension. Don't go too high. This puts tension on the sciatic nerve. So from here, right where you feel a little bit of tension, we're gonna do a little dance with our head and ankle to mobilize the sciatic nerve. So when I point my foot, I'm gonna lift my head, and then when my head goes back down, I'm gonna pull my ankle sort of toes towards my nose. I'm gonna go back and forth like this 10 to 15 times. Doing this causes the sciatic nerve to slide, which can help, has been shown in the research to help improve blood flow and nutrient delivery to the nerve and to help reduce pain. So it looks kind of like a hamstring stretch, but because I'm adding the neck and ankle movements, it's a little more specific in mobilizing the sciatic nerve. So if you have pain that goes down your leg, this can help. It can help just if your pain's isolated in your low back as well. Okay, so a couple more repetitions. Perfect, last one. Good, and then set your leg down. Perfect, set your towel down. We'll go on to the next exercise, which is gonna be a lumbar flexion and extension mobility exercise. A lot of people know this as the cat-camel. You can do this for your mid-back and your low back. In this case, we're gonna do it for our low back. So you're gonna go onto all fours, and you're gonna think about kind of tucking your tail under, posterior pelvic tilt, rounding your low back, and then you're gonna switch to arching your low back. So we're just going back and forth. This is just a good, easy mobility exercise when your back is feeling more sensitive. Just kind of gets blood flow in the area, kind of stimulates all the different tissues without putting a lot of stress on the low back. I'm gonna go back and forth 10 to 15 times. Again, just sort of a gentle mobility exercise when your back is hurting. For most people, stretching and mobility exercises tend to give the most relief. So this, pretty much all of this video focuses on these types of exercises. Okay, a couple more, nice and slow, going back and forth. Just take it as far as you can. If you ever hit a point that hurts in any of these movements, then that's your stopping point. Just go to that point and work through a shortened range of motion. As your pain gets better, you'll be able to move farther and farther. Perfect. Okay, so that is our last mobility exercise. We've got one more exercise in this routine. The next one here is really our only strengthening exercise in this workout. It has a mobility component, but it will start to strengthen some of our core muscles, especially our lumbar extensor, our low back muscles. So this one's called the bird dog. And what you're gonna do is go on all fours, and we're gonna alternate lifting one arm and one leg. So you're gonna kind of tuck your chin in, kind of tighten your core a little bit, and then you're gonna lift your right arm and your left leg out, nice and slow, and then back down. Okay, and then to the other side, left arm, right leg. I'm gonna do a number of repetitions like that. See if we can get 10 reps. So each movement counts as one rep. So there's 2. Perfect. There we go. Try to keep your core kind of braced while you do this. Good. Got to kind of stabilize and hold that position so it works a number of different muscles, but it's also just a good mobility exercise. It's not a high level of stress on the low back, so it's can be a good starting point. It's one of the primary exercises we use with people when they are experiencing low back pain, but we can't put a lot of stress on the back yet. Perfect. 2 more reps. Good. Nice. Make sure you're not letting your low back arch. Last one here. Okay, perfect. Now we're gonna go through that circuit one more time. A lot of these we did on our left side. So if you have pain that's just generally across your low back, or you're doing this as sort of an injury prevention program, then I'd encourage you to go to the other side with me right now. If you have pain that's, say, just on your left side, then go through the circuit and do the exercises on your left side again. So for the first one, we're gonna go back to our glute and hip rotator release. I'm gonna set the foam roller down. I'm gonna sit on the roller and lean over to the right-hand side, just the opposite of what I did the first time through. And again, looking to release and massage those gluteal muscles. So just work your way slowly through those muscles, looking for any tender points in the glute region. If you find any in there, then just pause and relax. Try to let that area release. Just working through slowly. Again, you can cross your leg. Notice that having the leg down is you don't feel anything or it's too easy. Okay, so just work your way slowly through those gluteal muscles. I've got a good spot right there. So just pause, try to get that area to relax. Okay, perfect. A little bit longer, find that I'm much more tender on this side. So you might notice one side is tighter than the other. People often have asymmetries like that. So just try to work the area out a little bit. Okay, perfect. So next we're gonna go to our stretch of those muscles. Again, straighten the other leg out, pull your knee to the opposite shoulder, and you're looking for a stretch in those gluteal muscles. Again, you can cross the leg into the figure 4 position, reaching through and pulling up this way to stretch the glutes. People vary in which one they like better, so you can do this one or you can do this one. Just looking for holding for around 30 seconds and a stretch in that glute region. Good, take some deep breaths and just let it relax. Nice. All right, from our glute stretch, now we're gonna go back to our hip flexor stretch. So like we did before, except for this time we're gonna have our right knee, just gonna flip your position. So right knee on the ground, left knee forward, hands on your hips, tighten your abs and your glutes, again, to kind of preset your pelvis. And then from there, I'm gonna lunge forward slightly until I feel a stretch on the front of my right leg. And I can really feel that my right hip tends to be tighter than my left. I can feel a good stretch right here on the front of my right leg. Thinking about a 30-second hold or so. Nice job. Make sure again on this one that your low back isn't arching. Try to keep your abs tight and your glutes tight. Perfect. Okay, from here, we're gonna go back to our sciatic nerve mobilization. So you're gonna grab your towel and this time wrap the towel around your right foot. Straighten your left leg out and make sure, like I said before, pull up just until you feel a bit of tension. Don't go too high with nerves. You've got to be careful. If you pull too far into pain, it can kind of flare things up. So just right to where you feel tension. And then we're gonna alternate lifting the head and pointing the foot, and then pulling the ankle down and setting the head down. So go back and forth here to mobilize the sciatic nerve and stretch that posterior chain of the leg, the back side of the leg. These mobilizations often seem kind of crazy, but in the research, they